and welcome to the Way to Live Well podcast. My name is Anna Maria. Welcome to the show. On today's episode, I'm going to be chatting to you about the connection between mental health and back pain. Back pain is not all about your back. How can that be, you ask? Well, one of our biggest realizations in pain biology research in the past decade is that the amount of pain we experience doesn't necessarily relate to the amount of tissue damage in the body. So let's first get into a little bit about the distinction between acute pain and chronic or persistent pain. Acute pain is that kind of pain where it's caused by an injury. So pain signals send information to your brain that this injury requires attention. Perhaps your body goes into a healing state to recover, or you need to see a GP or medical professional for diagnosis, just in case there is disease or inflammation connected to that acute or sudden onset of pain. If this pain receives treatment, for example, and continues to persist after say 6 weeks, it might be that you are starting to go into what is called chronic or persistent pain. So chronic pain or persistent pain can be that which continues on after you have presumably healed from any tissue damage, and you continue to experience the pain. And it can also be that kind of pain which arises time and time again, perhaps without any really distinct cause or reason, which is called idiopathic. So a pain that comes up. Idiopathic simply meaning we don't exactly know the cause or reason for this pain arising. I've had many clients come to me telling me that their GP has told them that this pain is probably attributed to getting older, and perhaps it's something that they're just going to have to live with, which is not very helpful, in my opinion. So when it comes to pain, no two people will respond to back pain in the same way. Even if subjectively they're experiencing what they call the same level of pain. So say if we have a kind of scale of pain from 1 to 10, and you ask these two people, where do you experience that pain level? And they both say around 8 or 9 on the scale of pain. And even in that, people have different thresholds for pain. So their experience of what is an 8 or a 9 is going to be totally different from one person to the next. I'll often get mothers coming into me and saying that, on a scale of giving birth to this pain level, giving birth was definitely a higher threshold, but that this particular back pain, because it's niggling and ongoing, is more of a hindrance, because you don't know when or how the pain came on and when it will end. So this can be very frustrating. So why is it that two people with the same subjective pain experience can have a different response to it? Well, this has a lot to do with our individual outlook and ability to recover. And what we understand now is that different people's ability to respond to their pain is due to their psychological attitudes, outlooks, and life circumstances. For example, if we take Bob, age 50, before he started receiving treatment for low back pain, he already began to make a number of positive changes in his life. He quit smoking, he started going to India on a regular basis to do yoga, meditation, and to do a detox. Bob is also in a very comfortable economic situation, and after just a few sessions of treatment and some home care exercises, Bob has a generally positive attitude towards his ability to recover. And then when we take Mary, 38, who is taking a break from her career as she was feeling overwhelmed and potentially heading for breakdown. She was anxious and exhausted and was also raising a young family. She's worried about the burden of her husband having to support the whole family, and she's been suffering with this similar back pain as Bob for a number of months, and she's tried a couple of things to resolve it with not much luck. Who do you think has a better chance of recovery in the story? If you guessed Bob, you'd be correct. It brings us back to our opening statement, right? So back pain is not just about your back. Research has shown us that pain is not just due to tissue damage, it's influenced also by psychological and social factors. This approach has become known as the biopsychosocial model, or we'll call it the BPS for short. This was proposed first by the psychiatrist George Engel. And for those of you who are into yoga, this concept may not seem so new, right? When we think about the mind-body connection, this really fits into that idea. This means that pain is heavily influenced by our brain and by our beliefs, our feelings, our emotional state, and our sense of control over our circumstances. All of these things play a massive role in the treatment for our ongoing pain. We need to be looking at the person and not the condition. And this will ultimately help us to become more of a partner on each person's individual journey towards pain recovery. So how might understanding the psychological factors that impact your back pain help somebody who is potentially already being treated by a medical professional for their back pain? Let's take a little look into the psychology behind pain. When our physical movement becomes limited, this can cause psychological distress. We might begin to avoid movements, fearing that they may cause us further injury or amplify the pain, and therefore creating more pain. This causes then stiffness in the connective tissue, the tendons, the joints, and therefore leads to immobility, which in turn creates even more pain. And for a very long time in our medical history, we believed that rest was best. So not moving the injured area, being even in bed until you felt like you were recovered enough to get out of bed. A lot of this stuff continues on in kind of our memory of what is best for treating our pain. And that can kind of restrict our movement even more, having this false impression of thinking that rest is best. And of course, that's not entirely untrue. In the case of acute soft tissue injury, the first thing to think about is to protect the area. So to stop whatever movement you were doing, to protect it, remove any load from the area, and to maybe wait 1 to 3 days for a little bit of recovery. But then ultimately, what you want to start to do is to bring back a little bit of movement, to load gently back into the area, so without increasing pain. And this really helps to promote the repair and remodeling of the tissue. It helps to build tissue tolerance and the capacity of your tendons, muscles, and ligaments back again. And then to begin to exercise again, right? So evidence really supports the use of exercise in therapy in the treatment of many types of injury as well. It helps to restore mobility, strength, and proprioception. Avoiding pain, of course, to promote optimal repair in those areas as well. Pain can be used as a guide as you continue on the journey of recovery. Progressing your exercises gradually to increase levels of difficulty while always being very mindful of where that pain threshold is and witnessing it as it changes and moves as you regain mobility and strength. Another psychological aspect impacting our experience of pain is something that is called catastrophizing. So we begin to tell ourselves stories. We begin to fear the worst case scenario. So for example, I've hurt my back, or my back is giving me pain due to some unknown cause, and I won't be able to work anymore. I'll lose my job. I won't be able to feed my family. I'll lose my home, etc., etc. We all have had these experiences, late at night when we experience that unknown pain and start to wonder if it is something more ominous. And this can be exacerbated by those feelings of pain and uncertainty with regards to our pain conditions. Often, if there is a pre-existing tendency towards anxiety and expecting the worst, so this kind of catastrophizing mentality, this can amplify our pain experience, as well as past trauma. That can be a factor in our experience of pain as well. The ability of our brain to regulate and control our emotions, and this being really impacted by past unresolved trauma. Our ability to pay attention can be affected. Our sense of lack of control is really impacted here as well. And this can have a really compounding effect. We can lose our ability to control our distress. Anxiety becomes amplified, and we may not be able to focus on anything else. So the pain becomes all-consuming, and it seems like the only thing we can focus on. And it's not just pre-existing mental health conditions which may make our back pain worse. Pain has been shown to actually rewire our brains. According to a study conducted by the NIH, which is the National Institute of Health, in the case of people presenting with acute back pain, remember, this is the type of back pain that usually relates to tissue damage and generally recovers within 3 to 6 weeks. Brain activity in response to the back pain was limited to a region of the brain that is connected with acute pain. This study also took into account people who suffer with persistent ongoing pain. And when they looked at the brain imaging from these people's brain scans, the activity shifted from those regions of acute pain into regions connected with emotions. This may explain why anxiety and chronic pain are so connected. Of course, there's a long way still to go in understanding the impact of this and the reasons perhaps why pain is so connected to our emotions. But for now, what can we do to help with this kind of chronic ongoing pain if it's so tied up with our psychology? Thankfully, psychological and complementary practices have been shown to be really, really helpful for back pain. They help us to work with pre-existing psychological factors, helping us to begin to make those changes, changing how you perceive the pain, and also alleviating psychological factors such as anxiety and catastrophic thinking. Those are those factors which help to maintain that experience of pain in the body. Many studies have been done around the practice of mindfulness-based stress reduction. This included some of the following practices, which are really beautiful practices. That practice of following your breath, body scanning, guided imagery practice, loving kindness practices, mindful eating, mindful walking, mindful conversations, observing one's emotion, mindful yoga, gentle, non-traditional type practice with a focus on the breath rather than achieving certain postures, and other modified movements for people who are perhaps limited in their physical ability, so perhaps practicing while seated on a chair. Cognitive behavioral therapy is also a really beautiful practice to help support back pain. It can be helpful for preventing acute injury from turning into chronic pain in the cases of people who have a pre-existing condition of anxiety or even depression. So let's be clear. Though all the evidence points to the fact that the brain is largely involved in our experience of back pain, it doesn't mean that we are minimizing the experience of pain, and it certainly is not to say that the pain is all in your head. We need to work with the mind, focusing on brain-based exercises to change our mindset around pain. We need to practice compassion towards ourselves and retrain the brain through gentle movements, coming back to that body experience, taking gradual steps towards reassuring the body that it is safe to move, that it can regain full range of movement, it can move out of pain, it can find options that help to keep the body moving even when there is pain, and finding all those different adjustments and ways of moving that support a healthy mindset around movement. On the Back to Health program, I share with you all the tools and techniques that help to assist this healthy mindset to move out of pain and to restore mobility and range of movement for you or your clients. Send me a message to get yourself on the waiting list for early access to the program, which starts in mid-November. I'll also have a range of special guests on the program, and all geared towards helping you and your clients recover from back pain. If you like this episode, please feel free to like, share, drop me a comment, and I hope that you have a beautiful day and be well.